Medical XR applied in healthcare. So our speakers today are Dr. Neil Ralph, who is head of technology and enhanced learning at the Health Education England, and he's leading national function with NHS that aims to maximize the impact of learning technologies and simulation-based education and how we train and educate the healthcare workforce. This organization works with local, regional, and national system partners to leverage these approaches to meet their workforce learning needs, underpinned by evidence-based approaches. The team supports access to learning technologies through its capacity to develop and deliver learning at scale via its national digital learning services, e-learning for healthcare, digital health solutions, and the Learning Hub. It also seeks to expand and enhance the adoption of XR and other immersive technologies through various approaches, alongside support of the educational workforce through its faculty programs and enhancing the learning through its TL maturity assessment. Our second speaker is Ross O'Brien, co-founder of XR Health Alliance. And Ross Ross O'Brien brings 15 years of research experience in the healthcare industry, mainly focusing on mental health and equity of access for underserved communities and digital innovation. He recently exited the UK's National Health Service as Associate Director of Innovation and Technology. He also previously worked as service lead of the Grenthal Health and Wellbeing Services. Ross was also the program lead of the London Digital Talking Therapies program at Healthy London Partnerships, where he worked to establish a digital signal point of access and triage tool for Londoners accessing NHS psychological therapy services. In addition to these achievements, he is also founder of the UK XR Health Alliance and the Whole of Medicine Association, and was a lead author on the growing value of XR in healthcare in UK, a report bringing together UK government agencies to create a strategy for UK immersive healthcare. And finally, our moderator is Kavya Perlman, who we all know and love and needs no further introduction. So give it up for the panel.
Thank you, Julia. And I'm truly honored to have with me today Dr. Neil and Dr. Ross O'Brien. Simulation and immersive technologies are revolutionizing healthcare and education, growing in popularity across all sectors or disciplines and offering different ways of supporting and engaging with learners. Health Education England has been collaborating with XRSI's Medical XR Advisory Council and several key MXR stakeholders such as XRSI to build baseline standards for this emerging field. This panel will let's discuss what are the potential considerations that we should make for safeguarding the medical XR ecosystem. Let me start with you, Neil. Why is it important for individuals and organizations to have these digital capabilities?
Can you hear me okay, everybody?
Yep.
Fantastic. So thank you, Kavya. It's a great question. And just by the way, it's lovely to be back in Altspace for Metaverse Safety Week for another year. So why is it really important? Well, more broadly, we're entering into a rapid digitalization in the way that we deliver healthcare, almost ubiquitously across the board. So Neil, all of our healthcare professionals.
Sorry to interrupt, Neil. If you could just click Host Tools and amplify your voice so that everyone can hear you better. Host Tools and amplify your voice.
That is on. Is that okay?
Great. Thank you.
Working. Great. Okay. So I'm just talking about how we're seeing a ubiquitous growth of digital tools that our healthcare workers are coming across all aspects of the work that they do. And so whether it's around electronic patient records or around describing healthcare apps on smartphones to patients, we need to make sure that our healthcare workforce have a real baseline in skills and knowledge. And this is going to be really, really important as we start to see if what we're expecting to happen is a real growth in the adoption of XR technologies, real growth in the adoption of coming into that sort of metaverse type space over the next decade. We've done a lot of work with leagues across the NHS, across all different roles, to create something called our digital capability framework, and it really identified the real gaps that we have across the workforce around not just their technical proficiency, because many people are very adept at using their smart televisions or their tablets, etc., ordering all of their deliveries online. Actually, what we see is variation in that, but what we see also is variation in the people, the level of knowledge people have, or confidence in their knowledge around critically important areas, information and data governance. When they move beyond something that has that really built in explicitly as a platform, when they move into areas that are more complicated, you really need to know that they understand how information is being managed, and they have confidence in that too. And then whether they're able to communicate that either to patients or to colleagues, or even better, to be able to teach that. So what we're looking at within that capability framework is how we pull all those aspects together to help people better understand that actually there's a real breadth of knowledge and capability people need to be able to have. And what we want them to bring is a level of expectation. They're interfacing in the healthcare environment, whether it's about training or anything involved in anything patient or public facing, that's been correctly assessed to be safe within that environment, and they need to be able to look out for the signs where they have concerns about that too, because we're thoroughly immersed in this space, and we need to make sure that and as we benefit from what these technologies can be able to do to us, we've got to make sure that people are not just passengers within that, they're contributing to making sure it works well for us and we get all the benefits, and we minimize those disbenefits. Do you think, Kavya?
Muted, sorry. I thought that was only happening on Zoom, but I guess we are. It travels across platform. So let me go over to you, Ross, and thank you, Neil, for that baseline, highlighting the importance of these things. So Ross, where are we? And where are we headed with respect to the medical XR ecosystem? What are we trying to address here, and why? I know it's like, a loaded question, but I look to you to sort of paint this picture of like what's really going on in the ecosystem. Not a whole lot of people have this sort of a full spectrum understanding of how far we've come and where we're headed.
Thanks, Kavya. Hello, everybody. I was lucky enough to be in the audience earlier when there were some good questions coming around. Kind of, I think Joey, you posed a question around what is it? Like, what is medical XR? And this is kind of, if we go back around 5 years, this is the position I was in as a practitioner, mental health service, in response to a trauma in London. And we started to use XR or VR specifically to reach out to a traumatized community that didn't really want to talk or engage with the NHS. And when we did and found it was quite successful, we started to look around for evidence of XR being used elsewhere, either in the UK or globally, where its application in healthcare was successful. And what was really interesting is on those kind of journeys and travels into this kind of new nascent world for us, we found evidence in clinical skills training, in education, lots of instances of innovation for XR in mental health, and also physical rehabilitation, and the management of pain as well. They seem to be the kind of the principal areas that work was going on. And as it started to become a real passion project, I was just amazed by things like the lack of need for for medication for children that had been in quite a traumatic accident, like a road accident or something like that, and the fact that by using a VR game that was modified to essentially have the rehabilitation plan and course of treatment within the game, the adherence was so much higher. The children were actually okay and keen to have their own, and we found inspiring stories again and again and again. And as we started to develop a network in the NHS, there's a great Facebook group by a guy called Keith Grimes called VR Doctors, which was kind of a really lovely resource that we initially tapped into, and then more and more kind of resources globally that we found. The more we unearthed really good practice, the more we realized that people were just working in complete isolation. And as inspiring as this was, it was also a bit of a worry. And then latterly, we started to work with Neil in Health Education England. We started to work with NHS England, so the national commissioning body for health services in England. And we started to work with UKRI, or UK Research and Innovation. And essentially, we set out to map what all of the different areas were in the UK that were working in XR Health. And when we started to map them and really kind of link together all of the individuals, we found that there was quite a lot of inhibiting factors that stopped really great work scaling. Kind of an example of one of these would be we saw a company that we work quite closely with really coming up with a great solution and going and getting into hospitals, and in some hospitals it would go and it would be used amongst patients, and in other hospitals it just wouldn't get past the front door. And it kind of transpired that in terms of medical device licensing, it was just really unclear, essentially, what XR Health was, how it should be judged, how it should be licensed, how it should be evaluated. And for one kind of group of people, it could be construed as a medical device, and for others it couldn't. And so we essentially set out, working with Neil, as I said, Health Education England, NHS England, UKRI, to come up with a report and a set of recommendations that set out kind of a pathway for, if you were going to take a new innovation or a nascent XR Health idea, how would you essentially take it from a very small idea that had been used amongst a couple of patients, and then move it along a pathway so that it could be scaled, it could gain more evidence about its efficacy, and then how would you essentially kind of create a set of standards around it, and then finally where would it go in terms of procurement? So what is the common space for XR innovators to go and sell their innovations, but also for people to confidently go out and purchase them? So that was our kind of series of recommendations. And now we're very much at a point where we're starting to think, okay, how do we set up standardization in the UK? And that's where we're exactly at the moment, really. There are frameworks out there that we could use for XR standards, but at the moment we need to work with those bodies and to start to update those frameworks in order that we have a common framework. The framework that we've got in the UK that we can use is something called the Digital technologies assessment criteria, DTAC for short. And at the moment, it's used a lot for digital therapeutics, but it doesn't cover XR, and that will be kind of the next part of our journey.
Amazing. Thank you, Ross. And so, as we talk about DTAG, I want to go over to Neil. Neil, what is this DTAG, and how can the MXR ecosystem benefit from it? Why does the market need it?
Does the market need it? Brilliant. That's a really great question, and thanks for Ross also for setting that up. DTAC is mandated across the NHS, and it really is the culmination of bringing together all of the key standards that need to be met, that are written into our regulations, into our legislation, and it brings together best practice as well. And I think that's really one of the beautiful things about DTAC. It's not just a hurdle to be jumped over, that with good reason, and I'll go into the sort of categories, but also it's about what are some of the best practices that we want to make sure everyone is aligned to, that enables us to get best value for money on any purchasing of technology as it's brought into that healthcare environment within the NHS. So it is guidance, or it's standards that those in a role much like mine, for instance, need to abide by in terms of buying technology in. So it's starting to put some minimum criteria in place for purchasing, for spending in the UK or in England, taxpayers' money on technology that's going to help us in all the different ways we need it to. But what it also is a set of standards that vendors need to start to build into their products if they're not doing already, to be able to make sure they have access to being able to deliver solutions into that NHS environment. To give you an idea of what it covers, it's got 5 key areas. One is clinical safety, probably less pertinent, but still pertinent for me in that education space, because still being brought into an education, typically into a healthcare environment, really, really critically important. What's the governance around that in product development? What's the governance around that within the environment that where it's being brought into? How are those aspects managed? And then that links nicely into data protection. So what are the policies and procedures, and what's the rigorous nature in which people's data is protected? Now, as you'll all know as experts in the field of XR, we are moving into a space where we can collect data on people like never before when people start to interact with these technologies. So we've got to have really robust standards in place around data protection, and these standards link directly to our laws around information management in the UK. And then that moves nicely on to technical security, to interoperability as well. So it's not just around robust resilience, but it's also around how do you bring stuff in and help things work with other bits of technology in a safe way too. Because as we know, we'll increasingly see from platforms and systems sharing information with other platforms and systems. That's both got to be something we seek to, we put some demands around, because it enables us to bring greater efficiencies, extract greater value from the technology, but also those APIs, those information sharing links have got to be as resilient and robust as the platform itself. And the last one, I think, is critically important, making people think about usability. And I think what I'm really seeing coming through as a really sort of shift in paradigm in terms of those in digital roles in the NHS is really scrutinizing usability, understanding users' needs, and really not just about what the technology does, but what it can deliver. What's the benefit? How's it going to make a difference in a safe way? And that what goes hand in hand with that is things like accessibility, and we've got stringent rules around accessibility being applied. Now, we risk with these technologies, if we don't pay attention to usability and technology alongside security and data protection, that we start to disenfranchise people, is we don't understand the different diversity of human beings, And what we find is, safety doesn't necessarily just come with the fact that there might be some vulnerabilities from information. It comes with the fact that people don't feel comfortable in the piece of technology that they need to interact with. That whether it's they've got some physical requirements or they've got other requirements. We need to hold those into hand. I mean, this goes deeply. If I can just slight tangent, Kavya, if you don't mind, when we're thinking about the potential for education and training, one of the things that we're really, really interested with these technologies is how do we better represent the diversity of people that we have in all shapes, sizes, and colours that live, that are our citizens in the UK, and how do we make sure people are exposed to that diversity? Because what we want people to be able to go into the real world following any sort of training interaction that might be simulated in XR is to be as the best possible clinician they can be, working with whoever is presented to them. So that usability and accessibility, I think is as important as making sure that it's safe and secure.
Fantastic. I really love that part, and thank you for prioritizing diversity, very close to our mission at XRSI, and also security, privacy, and safety. Just want to quickly reflect back on my experience back at Facebook in 2016 during US presidential election time. I was the third-party security advisor, and practically the suppliers coming through the front door, it's such a critical aspect, especially to safeguard the kind of information. And back at Facebook, there was no health information that was being dealt with, just a few data points. There were about 5,000 data points that Cambridge Analytica had on American back then. And now we're talking about approximately like over 2 million body recordings based on Stanford research in 2018-19 within 20 minutes of virtual reality sessions. This is way, way more data today as the technology is used for medical XR applications. So thank you, Neil, for prioritizing all these very, very important aspects. As we talk about these things, there is a particular intersection, which is, standards sort of including certain technologies, such as artificial intelligence. Ross, I want to go over to you since you're working with AI. And so how does that kind of fit into this update? Clearly, we have lots to learn from this. So what are your thoughts, and how is this intersection is kind of included in these global standards that you guys are so carefully crafting?
Yeah, thanks, Kavya. So in my day-to-day role, I'm the managing director of WISA. And WISA is an AI chatbot that's used in mental health to support patients, both before they access therapy and actually as a therapeutic support tool as well. And what we've seen with that is, again, it's like XR. It's a nascent technology. It's expanding at a rapid rate day by day, and again, it's kind of used nowadays more ubiquitously than XR is currently. But there was a period of time where the standards weren't around. And what we found in the UK there was quite a successful update of the existing framework. Neil talked earlier, and we talked about the DTAC, taking that as a kind of a baseline framework, bringing clinicians together, bringing legislators together, a legal team, and actually talking about what we could do to add to the DTAC or add to the baseline framework to enhance it specifically for AI and in the area that I worked in mental health. And I think before it happened, there was when I go door to door in the NHS trying to sell my wares, as I do on quite a regular basis, sometimes I meet NHS trusts or NHS bodies who simply say, we've made a trust-wide decision that we won't work with AI. It's too dangerous. You can't possibly mix it with mental health. You know, mental health is a very sensitive area. So the two don't mix, and that still happens today, even though we have governance standards around it. But you can see that, you know, it's seen as something that's difficult to do. It's seen as an obstacle that couldn't be surmounted, but actually what we have today is a set of standards around talking therapies and digital therapeutics in the UK, which is something that we could use globally. There's no reason you can't do that. And so what we're advocating for and what we're looking to start to do in the UK is to actually tackle it head on. Is to think, you know, we want XR to be used in healthcare, and in order to do that, we need to take this seriously, and we need to take real life examples where there are real patients and the clinicians that want to support them, and to start to map out and create this set of standards. And what you know, the discussions with Neil and other partners in the NHS is actually, why would we limit that standards to the UK? Because if it's being used in a clinical setting, if it's got, you know, if there's an evidence base that's developing behind it, there's no reason why this shouldn't be something that's simply a kind of an open access set of global standards that others can contribute to as well. And that's kind of where we're hopefully heading and what we would like to see.
Amazing. And clearly, I couldn't agree with you, Ross. I've had the opportunity to interact with some of the leadership from MDIC group from FDA, and certainly there was a huge gap where privacy, security, and some of these global standards are not addressed. So you're really filling in a dire need for the industry and the ecosystem. And so when you talk about sort of the global standards, though, what about the rest of the world? Are there any examples where you've seen some of the organizations struggle around it?
Yeah, we were XRHA were lucky enough to be part of a delegation to Japan this year. So UK government delegation going across to Japan to interact with government bodies, but also academic institutes, healthcare facilities, and commercial enterprises as well. And what we found that was really interesting was where COVID accelerated the application of XR, and where COVID was being used, say, to XR was being used to support people who were feeling lonely, because, you know, let's face it, COVID drove a lot of us apart, unfortunately, for an extended period of time. The application in Japan had been, there was, I think, one of the largest ever online XR events. And when we talked to the organizers, they created a virtual Shibuya junction, and they thought that perhaps that, you know, if they were lucky, they would get 50,000 people, 100,000 people tops. And at the peak, they had over 1 million users concurrently in Shibuya Junction, which is, if anybody's ever been to Tokyo and seen Shibuya Junction, it does look busy, but it never looks quite like that. So it was interesting because it A, took them by surprise, but B, their feedback was, you know, how do we manage that many people online? How can we guarantee their safety? What do we do in terms of communication? What are the standards we should be adhering to when that many people are in a virtual space together? Because it's not like it's not going to happen again in future. It's not like the world of XR is going to accelerate with kind of access to live sports and stuff like that. There will be, I'm sure, in the very, very near future, kind of a huge market opening up in these areas. But the thing that's not being thought about, and certainly in our journey to the States as well, when we've been in the US, talking to the various different organisations, the FDA and the organs of the government. Again, there doesn't seem to be a lot of joined up thinking going on, but there's an inevitability to the fact that people are going to gather in large numbers, and there's kind of a necessity for kind of a code of conduct. What's interesting, actually, coming back into alt space after a bit of time out for myself, personally, recently in alt space, is that the kind of like the standard use of the bubble. Organizations like Altspace are actually kind of leading the way in kind of personal safety and security in the metaverse, and there's other examples of it. But again, we're not seeing a standardization of it yet, and it's something we'd really like to contribute to.
Absolutely, and at XRSI, we're trying to address some of that, and more industries and governments and global ecosystems would adopt this. Neil, how about you? Anything that you're seeing with respect to the rest of the world, or any use cases that you could share with us?
Right. Well, yeah, there are some ideas that I've got. What Ross said just there. I'm really keen on developing some sort of ethical behavior framework going forward, because as we're going to see this exploding, particularly in the way we train and educate clinicians, we're going to see people training and educating together in that virtual space, and human behaviors and all their manifestations are going to appear. Well, we need to make sure people have got the mechanisms, if they're not inbuilt into the platforms, to know how to protect themselves and how to call out bad behavior, etc. So I just wanted to reiterate really that. But in terms of in terms of other examples around the world, there is some phenomenal innovation going on in all continents that we're coming across. One example that comes to mind is, for instance, in Uganda, Kigali, in their capital. And apologies, I can't remember the name of the hospital to be able to pronounce it accurately, but they set up a VR lab, and some colleagues in my team had a fabulous opportunity to go out and visit them to see this and to be part of helping them think this through to some degree. But really, it was an information sharing. And one of the things that they're doing using VR is that they're trying to help resolve one of the biggest causes of morbidity that they have in that part of in that country, in that part of Africa, and that's trauma from things like road traffic accidents, and then the lack of access in very rural parts, particularly, but even in the city, to people who are trained to be able to deal with traumatic injury appropriately. So they're finding that virtual reality becomes a very powerful tool for them to train at distance, to train people up, even training people up like taxi drivers who are part of these three-wheel taxis that tend to be ultimately very much typically involved in some of the bad crashes with some of the heavy goods vehicles. And they're using VR to give people some of the basic life support skills to deal with trauma, to build a bit of time for somebody to access a care worker with even greater skills that are needed to maybe hopefully save their lives. I think is a phenomenally powerful adaptation of these technologies, and I think it's a great example because it's, in many ways, what we've got to see the potential of this technology in all aspects of the world, and some of the greatest innovations are coming out from societies who've got the biggest need to innovate, and these tools are suddenly giving them the opportunity to do that.
Thank you so much for sharing that example, Neil. And we do have, folks looking out from Uganda. FXG Uganda is a community partner potentially listening to you right now, and also looking for more resources so that this domain could be further expanded. Remarkable story. I know that here in the US, I would say we're kind of struggling to even get a federal privacy act laid out. But on top of that, I realize even some of the Health Information Privacy Act, HIPAA, that hasn't been updated, and Medical XR provides the inferences of data, so we need to definitely do a better job. And I'm really glad that it's coming out of the NHS to include and expand global standardization. So when it comes to standardization, then potentially legislation, could you please shed some light on the legislation pieces? What all are the types of legislation that you think that should be prioritized, should be looked at on the very important discussion?
You would have to excuse me because my microphone's cutting out a little bit, but you were up to the legislation that's important to us in terms of XR. Is that right?
Yeah, essentially, and what comes to my mind is potentially accessibility or any of those type of legislation. But perhaps you could talk about the AI Act from UK or from the Europe that's come out, and UK just recently declared that they are probably going to reject that and have their own version or something. So I'm just wondering, in terms of legislation and our medical ecosystem, what are the important aspects? Both of you, actually. Ross, you first.
Yeah, we're going through an interesting phase in the UK post Brexit. So as we've left the European Union, we're having to essentially either set up shadow legislation, so taking what we had in the EU, keeping it the same as it was before, but stamping a British flag on it, or actually starting to do something independently and differently, and with kind of a reasoning and rationale behind it. We do find ourselves in a tricky situation at the moment, whereby as we are governed by, we've typically for a long period of time been governed by a body called MHRA. That's now changing in the UK, and we'll be governed by our own legislative body called UKCA. And we see really we see decisions that are being made by these two separate bodies impacting on us in business because of the different kind of understandings or interpretations of what technology is and what it does or doesn't do. So a very real example of this at the moment in our AI work in the UK. The organisation that I work for is essentially trying to help the NHS as much as possible by using AI to streamline processes, take the boring and laborious tasks out, and also help clinicians make clinical decisions and help patients access therapy 24/7 in their own time, but also via AI as well as with human therapists. And we've kind of got caught in the middle of this changing legislative landscape, whereby we in the UK, when we're doing our work, the device that we have out there with the NHS is currently seen as a class 1 medical device. So essentially, that means it's a device that's been licensed to be used with a therapist in the loop. Meanwhile, our counterparts in Europe see us as a class 2 medical device, which means that actually we've gathered enough evidence to show that that type of device could be used without a human in the loop. But unfortunately for us, we have to be one or the other. We can't be we can't be both. And because we are essentially formally governed by MHRA and are transitioning into a period where we're governed by the UK body, but we're kind of halfway between both. It makes it really difficult for us now to run a business where we can guarantee what revenue we'll have over the next 6, 12, or 18 months. So I think for us, having clarity around the current and future governing bodies, getting the governing bodies to kind of join up on their thinking and their reasoning and their rationale in digital therapeutics is really quite important. But it's not, unfortunately, certainly for AI, it's not. We're not in a position where we're really able to influence that, and I think politics comes into it as well in terms of what the new organization wants to achieve and what the Europeans want to set as kind of global standards as well. So it's going to be an interesting foray into this world when we start to work more with XR here, because I think AI has shown us that there are fault lines and there are different schools of thought. And it's also shown us that there's probably a potentially a challenging journey ahead if the different bodies have different ideas. Like, as you said, Kavya, if the FDA and the states in general don't have a clear picture of how it will legislate for XR, and the Europeans have one version of it, and then the Brits have a different. How do we tie all of those things together? How do we get to a common place where everyone has a clear understanding of what it is they're creating and what it is they're selling, and for clinicians and patients, what it is that they're buying and whether it's actually safe to use.
Definitely a challenge, and that's what as we come to the closing time and wrap up this panel, I do want to maybe keep a few minutes for question and answers. But as we close this panel, Neil, I wonder, what do you feel kind of hopeful about, and any insights that you can share with the world, potentially maybe even close at a positive note. How are you feeling in terms of what is one thing I do like about this conversation is at least there is some sense of leadership coming out of the UK, and that is informative to the rest of the world, including the United States over at FDA, that we are not going to wait until he does something. So I really like that remarkable leadership, and I look to you for what are the positives that we can hope for.
Okay, yeah, I feel incredibly optimistic about the future here. Start with, there are some real benefits in focusing on using XR and how we educate and train, because that doesn't need to be classed as a medical device. And I think that's one step forward in us applying some of the rest of the other standards, whether that's cybersecurity standards, accessibility standards, etc. in place. And it enables, I hope, some more space to work through some of the complexities Ross has mentioned. And so there are some barriers, but actually there are some areas where the barriers are much lower, and that's really very exciting, and it's going to accelerate us. And I'm seeing, for instance, one of the pieces of work that my team are contributing to is looking at how we can transform and revolutionize the way we train family doctors, general practitioners. We want to create a completely sort of hybrid blended learning approach to that, and we can put the XR technology in those junior doctor, those trainee doctor hands. We're already designing some applications with industry that are, for instance, enabling our trainees to have end-of-life conversations with people, tricky conversations with people, or dealing with really sensitive areas like serious mental health issues. We're giving them the chance to practice that in their own freedom in a very safe environment. So when they're doing it with real people in the first time, they feel more confident, and that patient gets a much better experience. And then you have a GP trainee that's much happier, and of course, because they're delivering better care. Imagine scaling that up across. At any time, we have 15,000 GPs at training at any one time in England. And imagine all the different scenarios we could be helping people practice, and doing it together as groups as well. And that's just scratching the surface. If we're applying that in similar ways to our nurses, our allied health professionals, our medics in other specialities, we're starting to give them tools that they desperately want. Is how do we hone our art here? How do we use this technology to, as in some of the hospitals that we're working with around, for instance, simulate, to take medical imagery, and to be able to create that immersive three-dimensional view of bits of the body for educational purposes, but to plan complex surgery, etc. And suddenly you get patient safety benefits as well. And these technologies are not on the patient's heads; they're still on the healthcare workers' heads. We've got phenomenal potential here, and what really keen is to connect up. Make sure we've got the basics in place, keep innovating on top of those and learning from around the world. Start to get our healthcare colleagues confident and capable, and start to bring them on that journey with us. And then they start to interface with industry. And then what we've got is industry coming with technology that works, that can be accepted into that environment. And suddenly what you're going to get is the magic happening. And we're going to bring the cost of access down. We're going to see expanded adoption. And we're going to see that growing evidence base as well. And then really what we're going to see, Kavya, is a paradigm shift in the way we educate and training. And I truly believe that XR technology is going to be the heart of that.
That is so fantastic, and so much to look forward to. Thank you so much, both of you. I do know Joey, who had asked previously a question, is impatiently waiting to ask you both a question directly from NHS, and that's one of the things that is remarkable. You can directly ask questions, and even afterwards, I think Neil would be able to stick around for a couple of minutes to answer. So Joey, go ahead. You have a couple of minutes, exactly 2 minutes before we close.
It's very exciting hearing all of this, and I know that one of the issues that face. So I'm a student mental health nurse, and I work for Sussex Partnership Foundation Trust. So one of the big issues down here is IAPT, so improving access to psychological therapies. And I know that people, wait lists can, span up to 6 weeks sometimes more for people that just want access to basic therapies. Ross, you'd mentioned that there was something that you did in London. I'm going to take a stab here. Were you working at the Maudsley or something like that? You said that there was some kind of application of AI or technology that you'd used that worked really well. Because I'm just thinking of people that don't have access at home, that are waiting on these huge wait lists, that if they could access something like now. And just a second question, that trusts, when you go to them and you were saying that to try and sell your wares and try and sell your technologies, that there was resistance there. I suppose with most things in healthcare, we like everything to be really strongly evidence-based, and there to be a very clear cost to how would this save the trust money? How would this cut down a wait list? How would this help them out? So do you feel like you're there when you are selling your wares and trying to push this technology, or show this technology to trust?
Thanks, Joey. And we have 1 minute, Ross, and we'll wrap that quick.
Yeah, thanks, Joey. Let's chat outside of this after as well, because it's I could give you an essay, but the quick answer is yes. With AI, we have tools in the NHS from a variety of providers that can support people that are on wait lists in IAPT. I live in Hove, so we should have a coffee in real life anyway. Hey, big up Hove. And then in terms of XR, your question around kind of scaling it into trusts, no, there's not the huge evidence base that we need yet. That's normally what you would need to get into a trust. There are lots of great smaller examples of XR being used here and there, but we're just starting to gather the evidence and just starting to build that evidence base so that we can sell XR into the NHS. But we need to do a lot more.
Thank you. Thank you, Joey, for that amazing question. And you're welcome to stick around, interact with our speakers after the panel. But thank you, Dr. Neil. Thank you, Ross. I'm so grateful to both of you and your organizations to not only supporting Metaverse Safety Week, but making sure that you come up here, interact with people, and also bring all the real-time work, research, and knowledge to share with the rest of the world. Much appreciated. And thank you, all of you, for sticking around. Those who are watching live, really, really appreciate your support. Please stick around. We'll take 5 minutes break, and we will be back with another remarkable panel to dive into benefits of blockchain in the healthcare ecosystems. Thank you both. Thanks, everyone.
Thanks
Cheers,
so much.
Kavya. Cheers, Neil.